Welcome, my dear audience and friends, to another episode of Cancer Convos with Grace B. This is your host, Grace B, coming to you from New York City, the city that never sleeps and is home to Cancer Convos with Grace B. I want to thank you guys ever so much for your continued support and encouragement about this show and connecting with me on Instagram, on Facebook, and sending me very nice messages on YouTube. Thank you so much. This show aims to provide as much information as possible to you, the patient, to you, the survivor, to you, the thriver. Also to the caregiver. We must continue to appreciate our caregivers. So don't forget, research everything, question everything, continue to do your continue to get second, third, or even fourth opinions, okay? And don't forget, health is the real wealth. So on today's show, I'm going to bring about a fantastic lady. During my post treatments, I had something called lymphedema. And she's going to be explaining what lymphedema is. I should do that, but I would like her to do that because that's where she comes in. All I can say is that lymphedema is very uncomfortable, and it's as a result of after cancer treatments. So we'll go into that much later. Without much ado, I'd like to introduce Marian Barnick to the show. Welcome, Marian. Welcome.
Great. Thank you so much, Grace. It is just an honor and a privilege to be here with you and sharing our information. Thank you.
You're welcome so much, my dear. You're welcome. How have you been?
It is getting colder here in Toronto, so I am not enjoying that part of it. But
you know, same here in New York. The weather has dropped, honestly. So let's get ready. It's going to be chills very soon.
Another reason to exercise. It keeps us warm.
I know. I know. Thank you so much for coming on board, sweetie. I really appreciate your being here. I'd like everybody to know a bit about you and the reason that you're here before we dive deep into the discussion.
Absolutely, Grace. No problem at all. As you know, I'm a registered kinesiologist and cancer movement therapist, and I have done that for over 25 years. Yes. So that keeps me extremely busy, along with my 12-year-old son, who is extremely spirited and very athletic. And it's amazing for me to be able to keep up with him. So
I know.
Active, yeah.
Oh, wow.
But that is my motivation. Between my patients and my son, it's such a motivation to be in a position where you can truly give back. And I'm just very lucky and very blessed to have the background of movement therapy to be able to help patients that have just come into my life, and that's where cancer movement really started for me. So I don't know if I have a moment to tell you just about how.
Oh yes, really like to know how you came about carving a niche in this space.
You know what? Things just happen for a reason, I believe. And when I graduated way back, I started working in rehabilitation, and I absolutely loved it. I absolutely loved the assessment part of it as well, in finding the numbers and seeing how someone could progress and finding the research behind what was going on. And I started doing some work for insurance companies, and they would send me out to see patients and see how they're doing and see if they were maybe ready to go back to work. And that's how I happened to meet Perdita. And Perdita was a breast cancer survivor.
Wow.
And she had been off work for 2 years, I believe. She had gone through surgery. She'd gone through chemo. She'd gone through radiation. And when I met her at her home, she said, I guess it's time for me to go back to work. So I said, I don't know why the insurance company is sending me, but we're here for a couple of days. Let's see what you can do. And we sat down and did an interview, and I asked her about her rehabilitation. And she looked at me with this peculiar look. And she says, no, I have breast cancer. I went through surgery and chemo. I said, no, rehab after surgery, after treatment. She said,
She never heard of it.
never heard of it. Didn't know that there
Wasn't
was,
told.
no, wasn't told, wasn't aware, and was suffering, Grace.
Oh,
She
wow.
couldn't put on a shirt over her head. She couldn't reach her coffee cup in her cupboard. She couldn't clean her house. Her daughters, bless their hearts, were there to help her. But
Yes.
she just thought that this is how a breast cancer survivor got on with life. This is what God had given her, and she was going to just do the best with what she had.
Yes.
It and
Resignedly.
yes, exactly. Exactly. She was resigned to be happy with survival.
Hmm.
And I said, no, no, there is so much more we can do.
So much.
And that started my passion for people who are not getting the knowledge and not getting the information and not being provided with a chance to have a better life, and a better quality of life is really what it's about.
Yes.
Surviving, yes. My patients tell me that your mind goes right into a survival mode. As soon as you hear the C word, you go into survival. And it's live and die.
Yes.
But the survivorship and the quality of life, when your mind can settle down just a little bit, that's when, what am I doing with my life, and how am I surviving, and how happy am I? So that's what fueled my passion and really got me started in putting together a program that I was so lucky was picked up by one of the big hospitals in Toronto, wonderful cancer center. And I started in 2005 doing work with their patients for breast and prostate. So,
oh, fantastic. That is enough motivation to set you on the path, really. Because thank God for that lady, and you now saw a gap in what was needed and ran with it. And to the glory of God, there you are. You put smiles on people's faces. Bless your heart for that.
thank you. It is it's a labor of love.
Yes, it is. And it shows that you really are immersed in it, and it gives you total joy. It's evident. Now, when I was reading up about you, I had read on one of your feeds that, and permit me to quote, maybe you didn't know I was doing my homework, but I have to do my homework when I'm bringing guys like you on board. You said, the link between the mind and body is extraordinary and shouldn't be overlooked when it comes to healing and rehabilitation. You had just mentioned that, but the mind factor didn't come into it. So how did you arrive at this conclusion, please?
I think, first of all, in my own life, in seeing where that positive energy and the positive mindset, and if you will, the having a higher vibration feeds so positively into your life. I've gone through a lot of health issues. I've had 5 shoulder surgeries myself.
Oh my goodness.
Well, it really helps me understand the rehabilitation factor.
Oh, wow.
Myself and bringing it to a patient. I am not a breast cancer survivor, but a lot of survivorship within my life. And there is such a link between that positive and negative mindset. And when you get bad news and bad diagnosis, and when you are truly fighting for your life, then you can have a tendency to just shrink down and have only the negative input. But when you see that change, and it's a little bit of at a time, and you can bring that vibration up and bring your energy up, the mind controls the healing of the body.
Absolutely.
And the benefit I see when my patients come in and we joke and we laugh and we have fun and we celebrate the little gains that we can make, whether it be movement, whether it be in life, whether it be, those clean bills of health that you get, your numbers are down. That brings up that vibration, brings up the energy, and truly, even on the physiological and chemical level, it helps the body heal. So this is everything for this. And I truly believe it. And we work both sides. We work with everything from diaphragmatic breathing for getting into a positive energy state, and the movement so helps with that. They're linked. So
Mm-hmm.
it's amazing to see the change emotionally as
Wow.
well as physically in patients.
Yes. And with your patients, um, how do they relate to the mind factor? Because already you have to deal with two things here. You have to deal with them coming out of some kind of abyss, physically. And then you also have to deal with their minds, how they're getting out of the abyss mentally. How do you kind of steer them away from being so, what should I say, caught up in the present?
I think it, first of all, maybe starts with gratitude.
Mhm.
And we look at whether I'm asking them to keep a gratitude journal, whether when they walk in the door or we get on our Zoom call and I say, okay, give me 3 things in the last 24 hours that are fabulous.
Yes.
And I have to make sure to bring my energy as well. Because if I come in, no matter what type of day I've had, I have to be grateful that I've been given the ability to help someone else. And when you
Mhm.
look at it that way, I bring my energy. And once you get to know someone, I bring it to, let's say, going to a hairdresser. You can
Mhm.
go to your hairdresser to get your hair cut. And once you get to know your hairdresser, you're going in there for so much more. You
Mhm.
are chit-chatting and talking, and you feel awesome when you leave, not just because you look great.
Mhm.
Something's happened that you feel great. You found that friend, you found that person who can pull out of you. Yes,
Connects.
it's a
Yes.
connection. Yes, yes. And finding that connection and finding it through movement is so easy. Whether it's the tough love of, you know what, I know you didn't do your stretches because I see how that shoulder's movement. Come on,
Yeah.
bring it, tell me. And they get to share. And the more we get to know each other, then the more that sharing comes. And then the negative energy and the things that maybe stuff down a little bit start to come out.
Mhm.
And it's really releasing through movement things that may be choked down, things that may have been just off topic that patients don't want to talk about, but
Mhm.
they get to. And movement and the benefit of it really brings out vocally, physically, spiritually a way to represent those issues. So it's just amazing.
Oh wow, that is great. I'm very happy about that. The mind is extremely important, and that's the first thing really that doctors, doctors and caregivers should actually concentrate on that particular thing. It's mental health. It's mental health.
It absolutely is, Grace.
Mm. So, when we had our first meeting, I remember when I was telling you a bit about myself, you said we were talking about creating a new normal for people like us that had, experienced cancer and were like kind of crawling out of the hole, if you know what I mean. So, when you spoke about creating a new normal, how do you think this phrase, creating a new normal, could encourage the person or the survivors who are watching us right now? What are the best steps to take in creating a new normal for somebody watching right now?
Absolutely. And I think it's a phrase that really has mixed messages in the cancer community. Having that chance at a new life, a new normal after diagnosis, after treatment, can be very positive in the fact that you survive.
Mhm.
But then survivor guilt can come in. And as she nods knowingly, look at that look. You know what I'm saying.
Absolutely, I do know.
And it,
Survivor's guilt is huge.
yeah, and it, you go through, and it so relates to what you're saying, Grace, is having that mental health part, having the spiritual and the mental side of treatment, because patients are given a diagnosis, they're given a treatment. It could be surgery and radiation, it could be chemo, whatever it is, it's treating the cancer, it's not treating the person.
Hmm.
And I think that's where the issue lies in when you talk about the new normal, because you're left without the disease,
Hmm.
but you're so different in so many aspects of your life, and having to take accountability of where you're at, what you may lose, family changes that may be made. You may not be able to have children and you were counting on it,
Hmm.
friends that you meet that you may have lost. There's so much that's going on. So the traveling, the journey after that diagnosis is definitely new, but it can be so negative. And that's where the mindset, and as we talked, needs to really be worked on.
Recalibrate.
Oh, absolutely. And I really am trying to change the term from new normal to new potential. Because I believe that many patients that I speak with, many patients that I treat, look at the benefit of diagnosis, not the treatment, because the only benefit of treatment is killing the disease, and it sucks.
Yes.
But the benefit of the diagnosis, to see what you have around you, to be thankful, to slow down, who may have spent 70, 80 hours in the office, not taking care of how they eat or how they work out, or maybe just not looking as closely around to the loved ones that are there. All of a sudden they see how amazing life is, and that new potential to change their life and the lives around them is extraordinary.
Absolutely. Absolutely. Mental well-being is, it's very integral for everything that we experience, at work, at school, at home, and everything. But for people like us as cancer survivors, because I'll speak holistically now, the rate of suicides that have come about just by hearing that one has a diagnosis is enormous, atrocious. So many patients have come out of it, and many who have attempted it have actually, many have attempted it, and then those who have gone have gone. So how do you explain this mind factor to somebody who is contemplating, such an act as taking their lives? How do you give them hope? Because I tell you that getting a diagnosis like that it's mind-blowing in a very negative way.
It's devastating, and it is such a change that no one is open. Even if you go in and have the biopsy, even, you've had an ultrasound, you've had the mammogram, you've had a biopsy, you're still hoping for a different outcome.
Oh, yes.
But then when that diagnosis comes, that hope is gone. You can no longer hope that you don't have it. You have to deal with it. And that's when the devastation hits, when there is no more hope. So the hope needs to change of hope for survival, hope for that new potential, hope to get through treatment, when treatment can be so devastating. And it's unbelievable to see the differences in how treatment can affect people on such a different level, where being bedridden, or we see patients that are out and still running 10Ks.
Yes.
And you don't know. Or if there's a recurrence and you know how badly the treatment affected you prior to, and you don't want to go through it again. And sometimes those suicides you talked about are because of a second diagnosis as well, that patients really don't think they can go through treatment again. It's truly hope and finding mentally and spiritually how to continue going 1 minute at a time, 1 day at a time, but not looking at 5-year survival rates, not looking at those numbers.
No.
It is a day at a time, and it's just going through. But it so leads back to what you were saying, Grace, that we do not have the benefit of mental health as an aspect of cancer care. And as a movement therapist, I know it's so hard to get the movement part in.
Yes.
It's the same thing with the psychological aspect, and trying to bring a full spectrum care process to
Absolutely.
cancer.
Yes, I agree with you. That has to be integrated in aftercare, because you find out that once the treatments are over, oh, that's it. Hardly anybody calls to say, how are you doing mentally? We know you're doing better physically, but mentally, how are you? Yes, that hardly exists. Only in very few cases.
Very few. And
Very few cases.
But that's why even talking about it, like your Convos with Grace B, having this out there to making this not a taboo subject.
Yeah.
There are, and if you look how many decades ago, people would not admit they had breast cancer.
No
People
way.
would not admit they had cancer. People
Prostate.
contagious.
Yes.
No, you wouldn't talk about it. So not only talking about cancer, but talking about mental health and getting this on the table.
Yes.
Communication. The other thing that I find patients really bring to light for me when we can sit and we can chat, I learn so much about the skill set of speaking with cancer patients and not being afraid. And that's one of the first things that my patients and my clients will say to me is, "You're not afraid to talk to me." I'm like, "Well, why would I be?" They say, "Oh no, people are afraid. They don't call. They see that their friends who aren't showing up, and it's not that they don't love the cancer patient. They don't know how to deal, how to relate, and they don't know what to say, and they pull back, and it's awful for the patient because now they're the ones that have to reach out in their time of need."
Yes, they don't. Like you rightly said, it doesn't mean that they don't care. They don't know what to say. They don't know how you'll react, because already you, the patient, you already you're walking on eggs. So anybody coming near you has to also walk on eggshells. Be very, very careful, and all that. Yeah.
And I found, just from my own experience, is being honest. Say, "You know what? I have no idea what to say, but I want you to know I am here for you, and I am open to talk day and night. I have, and whatever you can do. Don't ask them what they need. Don't ask patients what they need. They can't tell you. They don't know. They're overwhelmed with surviving."
Yes.
Yeah. So send a gift card for Whole Foods, or send a meal, or send a card that says, "I don't know what to say. I'm thinking of you. I love you." These little things that, in those weak moments, when you feel there's no hope, you can look at the card, you can remember your friends, or you can make that phone call for support. Because people are there. So
yes. And there was an outreach, a program I went to, organized by one of the big cancer centers, and we were discussing especially this caregiving part, which one lady was saying that as a caregiver, you are now experiencing the disease on another level, because now you were operating on the same level as the patient, but as an outsider, where you could feel everything, and that gave the caregiver actually enough push to be able to know what to say, how to act, what to do. But when you're far away, you don't really know what I'm experiencing, except you're close to me, or we connect on the phone, or whatever, So that especially really helps. It's like mirroring on it. You're a mirror.
yes,
You're bouncing off, vibes to the cancer patient. Yeah.
absolutely. And you take your cues, and that's the same thing as a movement therapist. I have to take my cues from
But
each
you're a caregiver.
Yes.
Don't even say you're a movement therapist. You are a caregiver.
Thank you.
Yes, because it's all integrated. It's the whole package. You understand? After you finish, ladies want to talk to you. Because you're open to listening to them. That's very important.
I love it. I love it. I
Yes.
love it. I love it. And I get, honestly, Grace, I get more back than I give.
Yes.
Because the understanding and being a vessel to, as you said, mirror and bounce off ideas, and be able to have just to be there, to have a voice for them, and they can share. And it could be things that they can't share because they have an older mother and they don't want to worry their mother, or they have children and they don't want to worry their children, or their husband may not understand. So all of a sudden, we've got this group of women that are together, and I can be the collaborator, and I can be the overseer from the medical side, but I look at just the exchange of ideas and emotions.
Mm-hmm.
It's beautiful. It really is.
It is, absolutely. I can't imagine. So I know that as a successful kinesiologist and movement therapist, you organize series of workshops in Toronto, also in the United States. I think I'm going to attend the next one when you come back. Um, who You've already said that your target demographics are women and everything. Do you have men included? And who are the other people that benefit from your programs?
Excellent question, Grace. Yes, right now my focus is primarily breast cancer patients, although all along and since the inception of
Mm-hmm.
my work with cancer patients, I've had men in programs as well. As I said, we have a prostate cancer program as well. But my push right now is on the post-surgical movement therapy for breast cancer patients,
Mm-hmm.
because the research is showing us long-standing quality of life issues with patients who do not get proper therapy right after surgery.
Mm-hmm.
The scar tissue, the lymphedema that you mentioned, and how devastating that can be in
That is
day-to-day
crazy.
living.
I mean, it's much better now because I can lift up. But then my right arm was as heavy as lead, so I had to keep
Oh,
on with those exercises.
absolutely. But what happens again, whether it be shame, lack of knowledge, not wanting to bother anyone, or
Mm-hmm.
not having the people around you,
Mm-hmm.
women get left behind. And I say women because breast cancer generally is a women's disease, although
True.
men are affected, of course. So it's the post-surgery I'm concentrating on to really get the online program just so readily available
Mm-hmm.
that patients will leave the hospital, they get the consent form from their doctor of what they can do, and boom, they don't
Mm-hmm.
have to find a clinic, they don't have to travel, they don't need to drive, they don't need to put a wig on, a
Mm-hmm.
scarf on,
Mm-hmm.
makeup on,
Mm-hmm.
clothes on, find a bra that might fit, um,
Mm-hmm.
and they can have the video right there in their bedroom and start with feeling better.
Awesome.
The workshops and the in-person. Now, when I'm online, I'm there live anyway. We're in a private group and I'm in there live and asking questions and demoing. But when we get together, that's the most fun. And that's really my goal, is the cancer retreats with
Mm-hmm.
just everyone bringing a positive energy, increasing the vibration and the gratitude with everyone involved. And for me, movement. Everyone needs to move. Everyone. I don't care what your diagnosis. You need to move. It's a benefit to everyone, and caregivers
Yeah.
included. Caregivers should be doing this movement with their
Oh,
patients.
yes.
No, there's
Yes.
no excuse.
They suffer along with the patients as well. They have to. In fact, they need it as well, more than even the patients, because they're all over the place. The
They
patients are
are.
just, on their butts or backs most of the time.
Great way to bond. Exercise together. It is a great way to bond.
That is nice. So for, like, I don't hide my stuff. I speak readily about having lymphedema and what I suffered with it and all that. Um, is it possible for you to show just a brief exercise on a stretch or something that anybody watching could adopt as a result of swelling or whatever?
Absolutely. And I think it's really important for your audience to know, Grace, that lymphedema happens not because of self-care or
Mhm.
anything the patient has done. This is because of treatment, because of surgery, because of removal of lymph nodes,
Mhm.
because scar tissue stops the movement of this fluid, this lymph, through the body. So it is so important to get these things moving in the body, get the
Mhm.
lymph moving, because it doesn't have a circulatory system like the heart does with the blood. The heart
Yes.
pumps that blood, it flows through your body. The
Yeah.
lymph doesn't have that. So that's why the movement, as you said, that you went through so much treatment to raise your arm, to
Mm,
get things moving.
mm,
And there are two areas. One, when the axilla, when the lymph nodes are cut, you're
mhm,
going to have the scar tissue
mhm,
that really blocks how
mhm,
that movement comes through the arm. And then right through the center area here, there's also the diaphragm works very well on pumping lymph through the body. So the breathing, which can become very shallow for patients because the rib cage can't expand properly, scar tissue, anxiety, our breathing changes, and we have that very shallow breathing up here. We want to take that deep into the belly and do that belly breathing and expand the belly. And I do have my Monday Moves with Marian. I do have a breathing video that shows you exactly what to do. I'll let you link.
You have to put that on my page.
Yes.
On the cancer page. Please do that.
Yep.
Okay.
I'll give you the link for that. And I actually have a special one that's just on mine. I'll give you that as well.
Please do.
You can see exactly how to do the breathing because it pumps.
Yes.
The lymph through the system that's being blocked. For the arm, and as you know, wearing bracelets, watches, rings can become not only something you can't do, but sometimes something you shouldn't do because again, it's blocking. But when we work on the joints, and that's what's important, is the little movements. You may see those pamphlets where they say, oh, make your fist. And I'm like, you know what? It's like saying, well, you may need something and it's okay, but we can up it. We can make it better with knowledge. Knowledge is power. You said that.
Yes.
You said to make sure, second, third, fourth opinion, keep searching, keep looking. And I'm here to tell you, the fist, that's fine. But let's start in moving the fingers. Move them back and forth. Then bend just the fingers. Get the thumb in there.
That's right.
Get the wrist moving back and forth. All of this is like a little heart. It's the little pump. This is done. You go to the elbow. You want the elbow to move. And again, no weights, just movement of the joint. And especially right after surgery, if you're not touching the shoulder, you can still move your fingers. You can still move your wrist. And you can still move your elbow. That is going to deter lymphedema from starting.
True.
And it will help alleviate. Once that's fine and you've got movement in your shoulder, that's when you're going to start moving that shoulder joint. But with your hands, which is probably, am I right in saying you feel it the most in the hands?
Oh, yes. You remember we were talking about guns and thumbs? Please do that.
I'm so excited you remember.
Do that. Guns and thumbs, or thumbs and guns. Yes.
As much as you can. The
Yes.
wrist stays straight.
Yes.
Then you come to the gun.
And then you feel that tension there.
Yes.
Right.
And the wrist is nice and straight, so it pulls right through.
Yes.
And then when you're really good, you
I've been practicing a lot, and really, for both hands, even though there's this, but it's really good. And you feel the tension, you feel how tight it is. When I could get to the second figure, I said, yes, I'm getting better.
But what happens, Grace, that tightness is a sign that things are not getting through. When the muscles are tight, the tendons are tight, then you're not going to have that mobility. So the lymph is going to stay put. That's why movement right after surgery, again, passion, got to do it. There's so many reasons.
True.
Mental health, feel better, lymphedema, shoulder blockages, all those awesome reasons to move. And you can, you're living proof of getting that arm back to feeling better, moving better. But you always have to watch. Lymphedema is something that may occur right after surgery. It could be down the line. So it's something always to be careful of, always to watch. And if you're not sure, you go to see your healthcare professional, your oncologist. You need to tell someone. You do not suffer in silence.
Oh, no, I don't. I scream at the top of my voice.
Well, that's
my oncologist knows me. They all know. But heaven helps, touch wood, it's been good. But I'm happy about that movement. So because I have a couple of friends who are going through post-surgery aftercare, and this will be good for them to know about. Yes.
Absolutely. Yes. Do not suffer in silence. Do not say that there's no hope and give up. No. There is. And even if it's just a phone call, then say, hey, is there something I can do? Or you know what? I feel awful. My arm is swollen. I can't. Or the other arm gets sore because of overuse. So you're so right. And smart woman, you do both. Because of
Yes.
the overuse, when one is not working, the
Yes.
other side can get very tight.
Oh, yes.
So, yeah.
When my in fact I became what did they say, ambidextrous,
Yes.
because I was now using my left arm to do a lot of stuff, my left hand to do a lot of stuff, and that made me think that I have to be exercising the same way I'm doing for my right arm with my left arm, because now my left arm was doing a lot of work, since this was, in bandages and everything was going crazy with this right one. Yeah. But I still, of course, I'll still remember, hey, I'm a good student,
What an
a
awesome
smart
patient.
student. Thank you, sweetie. So aside these physical activities and all that, what topics, because you talk about opening up, the ladies open up to you in the boot camps, and after physical activities, you talk about all sorts. What topics actually generate the most in your boot camps and workshops?
Number one topic?
Mm-hmm.
Hair. Hair. Women like to talk about their hair. Did they lose their hair? How did it come back? Did it come back curly? Did it come back straight? Is it a different color? And that's when I know that patients
Wow.
are at ease, because now it's all those little intricate things that you think that you can't talk about. Nails. Did patients lose their nails during chemo? A lot of people don't know that you can lose your fingernails because
Oh,
of chemo.
yes, yes, yes. My
Balance.
fingernails became very dark because of chemo.
Oh,
Yes, that's what the treatment does to you. So because they were dark, and because I'm, light-skinned kind of, I had to use black nail polish, dark nail polish, which kept on, to kind of hide, the crazy coloring. It was like blue-black. But a lot of women don't know what to do. They're like,
oh
oh,
yes.
um, do I use nail polish? Don't I? They didn't know whether to stop all those things, because you're coming out of you're going through cancer. You don't know if nail polish is even bad while you're under treatment, because it
Yeah.
still gets into the pores. So
Yeah.
all that is scary. But
How to care for wigs. What do
yes.
you do with your wigs? How many wigs can I get? Who should I talk to about
Hmm,
that?
hmm,
Um,
hmm.
Skincare.
Yes.
Radiation can affect skin. And what cream should you be putting on? Scar tissue treatment, everything. And that's where that sharing and that knowledge of from one to the other, it's, just a group of one helping the other. And on my private Facebook groups as well, that information, has anyone heard of, did
Hmm,
anyone try, has
hmm.
anyone read,
Yes.
do you
And
know
then you get
about?
the responses immediately. Yes, of course. That is a fantastic connection. That's how a group should be. And that's the same kind of thing I experience with other cancer survivors in my groups as well, when we talk about this. So yeah, that's good that asides activities and all, you guys can actually sit down over a glass of wine or something, or juice or whatever, and discuss this,
Wine
because
is good.
it it does help a lot to talk about all this.
It
Yeah.
absolutely does. And I feel fortunate with my groups as a convener. When it comes to something medical, I don't mind stepping in to say, okay, from a functional physical standpoint, I'm going to give you my benefit of my experience, my education. And if it's something outside of my scope, that's where we say, okay, you know what, this is oncologist, this is surgeon. And also to say, you know what, there's a lot of different things for different people.
Mm-hmm.
We don't approach anything negatively. What works
Yes.
for one, we celebrate that it works. We never poo-poo an idea. There's no way.
No.
So
No.
unless that person is at risk, then no, different things work for different people. So
Mm-hmm.
that is the benefit, and different people are at different stages. And that's one thing that I do have to mention, Grace, is the comparison. We do not allow that, because patients get, especially at the beginning, they get caught up. someone's on this drug and it's not as bad. They're not as sick as me. I'm more sick than this. I've got 10 rounds and they only had 6 rounds. Or, you know, my eyebrows and my eyelashes are gone and no, that brings
That's a killer. That's more devastating than anything. Once you start to compare the stages, I mean, my breast cancer is different from yours. When mine was caught is a different stage as when compared to when yours was, caught. So all those different things, my body is different from yours. My reactions to certain things different from yours. So comparing actually is a killer. You hurt yourself once you start to compare.
Yep.
Yes. You're already dealing with cancer, and then you now deal with comparing yourself to others. No way.
No,
That's
not at all.
killer.
No, everyone's on their own journey, and that's it. Where you celebrate your own journey and
celebrate yours, yes, and celebrate others too. You know, milestones, and the milestones can be just trying to brush my teeth during chemo, which of course I can't. You can't brush your teeth during chemo because already you have bleeding gums. You understand? So for 9 months I was in chemo. My toothpaste was salt and water, and and it burned, but it was also an antiseptic compared to Listerine or whatever. It was more natural.
More natural, less chemicals in the body. And again, those are other things to talk about, and maybe for another day, is just that decreasing that risk of recurrence with changes in your eating habits, the chemicals you learn about. And that again is that sharing, not comparing, and finding out, okay, what are natural products I could use? Where are the lists of things to clean my house? What makeup would have less chemicals than another? So again, these are the
we'll talk about that too, because right now I don't use all them. I use very organic cleaning materials now, because my daughter and I, we ordered, and you have the equivalent of Ariel, Tide, that is organic. They have different stuff, cleaning, abrasive materials and all that you use for scrubs, all those kind of things that they make specifically for people like us, and for those that want to go natural, organic, so
and you learn along the way. Like, to me, baking soda is my best friend. It scrubs my sink.
Yes, so baking soda is fantastic. It declogs and it scrubs. So that's it.
And I look at just, like my son learns that. So my son knows that the baking soda, he can put that in the, in the food for rising. And we also put that in the sink to clean.
Yeah, exactly.
So,
yeah, that has so many uses, and it's helpful to know that too.
But it's also passing along that information so more people learn.
Oh, yes.
Understand. And I mean, that's one of the things with just being in a community with giving people and seeing, it helps my son learn, and it's sharing that information. And I think that that's so important for me to highlight being of service to others. And he gets to ask me, say, oh, who'd you see? Who'd you talk to? And, he'll know that, oh, this person's doing this, or this person's, or if we're on a Zoom and he's home from home, he'll pop in and wave. That's awesome. So
that's nice.
Yeah, we made a trip down to Michigan not too long ago, and he had really long hair. He grew it long, 18 inches. He had
18 inches.
18 inches of beautiful blonde highlighted from God, virgin hair that he was able to donate to Wigs for Kids in Michigan. So,
oh my God, that's so sweet of him.
He got, because he's learning
about the to give.
So he went down, we went to Wigs for Kids, he did his donation, he got a certificate, he's so proud of himself.
Wow.
But he had a tour of learning how the wigs are made, learning natural hair and how that is so important. And it was just a great give back from them. And like you say, community, that's what it's all about. And when we're worldwide, as we are, and I know your roots are not even in this continent, the sharing of knowledge, Grace.
Yes.
We have no excuse, because we
none
have the
so ever.
None
so ever.
Internet.
Yes.
you share. Yes.
Yes, that's the most important thing, because when I come across people and they're like, "Oh, okay, I've heard about your show," and or you tell them, and they're like, "Oh, somebody passed your, the link to your show and blah blah blah." I'm like, "Really? Where are you?" And it's like, power of the internet.
Oh,
Okay,
yes.
power of the internet. And so far as you're putting out concrete information that is vital, um, you're happy that at least you get to share that information and people will learn and profit from it. Yeah.
Yeah, knowledge is power. And as you said, health is wealth. So sharing that knowledge that someone can have a little difference in how they feel, how they act, how they breathe. That's the wealth. It really
That
is.
is it. That is
I'm going to
it.
steal that line from you. Health is wealth.
Absolutely. Please. I mean, health is wealth is all over the place. You're not stealing from me.
You
You're
said
not.
it so well. I love it. Yeah.
Thank you, Marian. So great to have you, honestly. So, with your hectic schedules, you're already active and all that, can't keep track of you. What else do you do to unwind?
Oh, unwind. That's been something I've really had to work on. I am a workaholic. I
Me
love my
too.
work, but things do get stressful. And I find, because I'm a kinesthetic learner, I learn by moving,
Mm-hmm.
and I also relax by moving. So when I can get out in nature, when I can put the dog on a leash,
Mm-hmm.
go for a run, or just go and breathe. No earphones, no music, no podcasts. Just go and breathe. Oh, it centers me. It really does. I
Wow.
need that movement, the dog, and just, seeing God's presence.
Mm-hmm.
And it's amazing. And
Nice.
the other thing I really like is food.
Oh,
Like,
you're like,
I love food. Love food. So
who
my
doesn't love food? Oh my goodness.
Oh yeah, my son has taken up my passion with food as well. So we will put on music, and
Mm-hmm.
we will cook, and we will dance, and we will prepare the dinner. Now he does the decorating, so he loves to. He'll send me. He's like, "Okay, go away. I'm going to decorate." And he
Nice.
little piece of basil, a little drizzle of balsamic. He's got the bread, the baguette
Ah
slices.
la la, you have a little chef coming. That is a chef coming up, huh?
He loves it. You will see on my Instagram pictures
Okay.
of what he does. Even like the watermelon, he'll make it into a boat and cut little things to make it decorative. He made a bird for me out of an apple. He says, "Oh, I went on YouTube. I learned how to cut this," and he carved this beautiful bird out of an apple. And then he took my rice crackers and put my little pieces of avocado on them. And he brought it down for me as my little treat.
Oh, that is so kind of him. Beautiful.
That's my
Oh
calling.
yes,
That's my
yes, and I like that he's creative, because one must, aside from whatever other career or whatever, I love creativity. Nothing beats it, and
absolutely.
it's good he's starting to show that at an early age, you know.
Yes, absolutely. And promoting it and
And
allowing.
and the way you continue to encourage him is massive. Yes,
It's been a work in progress, so I
I
must say,
know, I
because
know.
it's our kitchen.
Mhm,
No, everyone out of my kitchen.
mhm.
I said, wait a minute, who is this benefiting? It's not benefiting him. So he has full reign. He's 12 now, so certain things he knows, certain knives you don't touch, or certain things. But oh my gosh, it's like this little experiment that goes on, and
That
he
is
embraces.
awesome.
Yeah,
Honestly, that is awesome. I love that. I love that.
thank you.
Bless you for doing that. You are um, kind of molding him for the next phase. You
Oh,
know, he's now maybe trying to decide where he's going. 12. His mind is all over the place now. You couldn't
absolutely.
keep tabs on him at that age, no, because he's experimenting with different things. Oh yes, but it's nice.
And I want to be able to open that up to him. I want to see the opportunities that life can offer.
Mm-hmm.
Also, how lucky he is to be in North America, and to have the food so readily available, and have, you know, all the little things that we take for granted, like, oh, we're out of honey, we need to go to the store. Sure, there's a store with honey, there's a car to get there. It's breaking it all down into just those, like I said, the gratitude. So, you know, saying prayers at night, saying what you're grateful for, you look at those things and say, it's going to pay off at some point. So, and hopefully he does the same with his children.
I'm sure he will. Oh, yes. And we pray for God to give you long life so you can see him do that for his children as well.
Thank you.
Amen. We pray for that, long life. So, my dear Marian, I've got to let you go very soon, as I have another interview after you as well. As a kinesiologist and movement therapist, please leave us with some parting words for cancer survivors and patients, and those that are going through some kind of rehabilitation right now. What parting words could you offer them, please?
Oh, absolutely. Happy to do that. We did talk about not comparing, and everyone has their own journey. And I think that's the most important thing, is to realize that we are unique and embrace your uniqueness. And that also is something in treatment. If you're going through not just cancer, but as you said, any type of disease or healing process, you're on your unique journey. But the body always heals the same way. So take your time, process in order, and any movement, unless of course your surgeon says, no, you can't move yet, or there's something that, you know, let's say a specific ailment that they say you've just finished surgery, 6 weeks, not this, or what have you. Moving your hands, going for a walk, seeing nature. These are the important things that I want. So it's the body, the mind, how they intertwine, and the uniqueness. Don't follow someone else's path. If you see someone and they're saying, you know what, I'm getting on the elliptical because I love the elliptical. I'm doing strength training because I love strength training. And you're like, oh, I guess I should do. No. Make your list. What do you love? What do you want? What are your goals? And then work towards them. You may hate the elliptical. You may just want to walk. You may love a rowing machine. You may want to, you know, go on a vacation and go on the beach and walk. I mean, all of those things. So keep your unique path, stay moving, and please ask for help. This is not a time to be stoic and on your own. This is a time to reach out and take the gifts around you and ask people for help, including me. You may not know me. Send me an email. Say, hey, I have a question. Leave a comment on Grace's YouTube channel and say, hey, you're a survivor. I know you've been there. Can you please help me with? And know that this community, although so vast, is also close in wanting to help and give back. So
that's right.
Please ask.
Oh, wow. Thank you so much, Marian. That is fantastic. I'm sure that anybody listening now will actually relate to you, relate with you. Come on my page, reach out to you. Please don't forget to send your link to my page so that I can share it around as well. Okay?
I will absolutely do that. And I have no problem in sharing that information. I want it out there.
Yes, so definitely.
Thank you, Grace. Thank you for that opportunity.
You're welcome. You're welcome. And thank you for the opportunity of speaking with you, of connecting and bonding with you, and bringing your light and information, expertise, and encouragement to this show as well. I know that anybody that is watching or that will watch our program will, you know, relate to where you're coming from, and also hang on to your wisdom nuggets and learn from there. And the most important thing is to take it, you know, share it, and let other people key into this information that we have out there for them. Yes.
It's an honor, Grace. Thank you so much.
Thank you so much. So I will wind up now before I say my final goodbyes to you. So, my dear audience and friends, we have been speaking to the beautiful Marian Barnick, a well-known kinesiologist and cancer movement therapist who is doing amazing things in her profession. So I'll be giving her information out there on my page, her link and everything when she shares it, so that people would go to her page and her website and YouTube channel and see exactly what she's all about. Thank you so much, everyone, for keeping a date with us. And don't forget, if you're not yet subscribed to Cancer Convos with Grace B, please do so as soon as possible. You're going to be missing out on a lot of things, huh? And thank you so much for following. And for those who are not following and liking us on Facebook, ditto. Okay? So thank you so much, and wishing you peace and light. Thank you, Marian, and I'll be seeing you next time. God bless. Bye, Marian.
Bye, Grace.
Bye, my friends. God bless.